Hello and welcome to the Global Health Matters podcast. I'm your host, Garry Aslanyan. We bring you an episode filled with optimism and inspiration. It's estimated that 68% of world's population will be living in cities by 2050. Despite the many benefits offered by cities can also be an unhealthy environment for people and the planet. In this episode, I'm joined by two pioneering city leaders who have taken up the quest to make their cities healthier places by encouraging safe and active mobility. In doing so, they are combating the environmental determinants responsible for non-communicable diseases and injuries. Jesús Carlos Soto is the Director for Mobility and Transport for the Guadalajara municipal government in Mexico. He is a citizen advocate turned civil service leader. Silpa Wairatpanij is a committee member of the Thailand Walking and Cycling Institute Foundation and a project manager of the Bangkok Healthy Cities Initiative. He is also an advisor to the Deputy Governor of Bangkok on safe and active urban mobility. Hi, Silpa. Hi, Jesus. How are you today?
Hello. Good. Thank you.
Fine, Garry. And you? Hello.
Great. I'm so pleased to have both of you today as guests. I know neither one of your career journeys started in health, and yet your work is having really direct impact on the health of your city, of your residents, of your cities. Maybe you could share a brief history of how this came about. Maybe we can start with Jesus.
Thank you, Garry. Sure. Of course, good morning. And thank you very much for the invitation to share in this space with Silpa and the Healthy Cities Initiative. I have a humanist training as a philosopher, although I started in the engineering side. But I had a vocational crisis made me change my path. At the end of my career in philosophy and social sciences, I became involved in the birth of a social movement here in Guadalajara that began protesting the imposition of traffic light-free roads in my city. So from there, we went on to demand a comprehensive mobility plan, not only focused on cars, but on people. As a philosopher, it made perfect sense to me because in that moment, I also had to work in communities in conditions of urban marginalization. And I knew how important public space was for people on those areas. It is all they have. So from there, I got involved for about 15 years in citizen groups that began to propose another city model, one where there really were spaces for coexistence between different ways of living. And I understood that this involves thinking about spatial justice and climate crisis. And then there are important health aspects in it, from road safety and the thousands of deaths caused by the model focus on motor vehicles, to the poor quality that in my city is quite bad, the air quality, and also takes many lives and costs year after year. So the most radical moment of my activism was when we camped for a month to stop the construction of an elevated vehicular bridge that destroyed several hectares of green areas and thousands of trees. We couldn't stop it, but it made us stronger, and later we were able to stop a 23 kilometers road. 6 years later, I was invited to create the first mobility and transportation direction from the local level of the city of Zapopan. I am currently in charge of the direction in Guadalajara, metropolitan area we have here that share these two big municipalities. So from these public agencies, we have promoted active and sustainable mobility, safe infrastructure, regulation of public space, education, and road culture.
Jesus, how many people live in that metropolitan area?
We are already 5 million people in the metropolitan area and almost 3 million cars. It's composed of 9 municipalities. Guadalajara and Zapopan are the biggest one.
Okay, great. Silpa, how about you?
Hi, I'm Silpa. I'm from Bangkok, Thailand. So my background is I'm working at Thailand Walking and Cycling Institute Foundations. What we have been doing is to promote walking and cycling in the city rather than just, for sport or exercise. We encourage people to use these kind of transportations, mobilities as an everyday use in their life. So we just come across opportunity to join with the PSC, Partnership for Healthy Cities. So we could see this is a great opportunity to join with municipality of Bangkok to get a grant on promoting safe and active mobility in Bangkok. The background of Bangkok has always been a car-centric city for more than 40 years. And we have been building road and expanding the expressway and highway. Still, the problem is the city plan. It doesn't accommodate people to move from their house to the stations easily. The reason is because we have a lot of dead-end road. We don't really have a plan for the road network or street before. So it's become harder and harder for people to walk or cycling in the city. So everybody need to use their own car just to make them convenience to go around the cities. Especially, we have the perceptions that walking and cycling in Bangkok is very dangerous. So people need to protect themselves by using cars. That's ironic. Um, for example, people need to use a car just to cross the road in some area. There are two department store and two districts that close together. Just one road separate them apart. But people cannot really use the crosswalk to cross this road. So many of us just decide to just drive there.
Okay, interesting.
Get into your car and go into the street. Yeah.
It was the same. It was the same in Guadalajara.
Oh, wow.
Yeah.
So we have example here.
We have Avenida Lopez Mateos Avenue that also have 10 lanes. Yeah. And in this avenue, we have traffic lights. But in 2007, the government decided to suspend the red lights and just have green lights. So that divided the whole city in one side and the other. And it was impossible to cross from one sidewalk to the other. And that was the motivation to have a social movement rising, demanding a different urban plan of mobility. But this is the same condition that
I am glad that I have like a real example here. We need to now change the environment of the city to accommodate people who need to use walking and cycling in the city. That's why this initiative grant from PSCs has come along, and we use this grant to have like a city lab inside the old town of Bangkok. And we have a university, Silpa University. A professor there has, designed these streets inside this area to have more space for sidewalk and less space for cars. We use lane reductions, narrowing the lanes, and also have like a extended sidewalk at the crossing junctions, so far and so on. So it's been an ongoing process right now, and we hope that by changing the environments of the cities to accommodate walking and cycling here, and in turn, it reduces sedentary activities. People have more activities, and that would reduce the cause of NCD disease.
So, as both of you, a ton of insight, and thanks for setting the stage for the cities where you're in. And clearly, a huge amount of people are going to live in cities. Some estimates to almost 70% of the people will be living there by 2050. And you already mentioned that the cities were designed with the cars in mind, not people, or not walking, not cycling. Not to mention the air that people have to breathe in those cities. So just before you started these initiatives and you started working on them, what were the health and sort of safety challenges in each of the city?
In 2015, Guadalajara was the second city with the highest ozone pollution in the country. And more than the 80% of the cars were non-verified cars. So the contamination and the controls over contamination were very high, old, and so we have a very old and highly polluting vehicle fleet. Around 53% of the vehicles in Guadalajara metropolitan area were over 14 years old and didn't have a catalytic converter. So more than 650 premature deaths linked to poor air quality happened each year here in my city. In that year, 2015, 5 contingency phase events where we registered around 80 pre-contingency phases because the pollution levels exceed the 115 points of the air quality index. So it was a very bad situation. And in the state of Jalisco, Guadalajara is the capital of Jalisco. In 2012, around 8,000 people were injured and 507 people lost their lives in the roads. So it is a very high rate here in Mexico. Road traffic is the second cause of death in the whole country, and is the first one in kids and young people. Just in my city in Guadalajara, we have around 70 or 90 deaths per year in road traffics. So that has been the challenge to remediate the air pollution and to avoid more road traffic accidents.
Okay. What about Bangkok, Silpa?
Well, the top 5 cause of death of Thai peoples is from 1, 2, 3, and 4 from the disease NCDs. And the 5th one is the road accident. So we have loss of 200,000 a year people, who die from
in the country
car crash, right, in the countries. And in Bangkok itself is around like 10% of it is 20,000 people only in Bangkok. So populations of Bangkok is around 6 million people here, and the amount of motor vehicles that has been registered here is 1.1 cars per 1 person. Imagine that. So that means everybody in Bangkok has their own vehicle somehow. We had regulations for so many years to drain all the traffic in the cities from one area to other areas. And that is traffic police jobs. And they have only one job, is to drain all the traffic out of their areas to be stuck in other areas. However, the number of death rate in Bangkok has been increasing. COVID-19 banned people from go out of their house. So in that time, the death rate has dropped like 40%, and the number of vehicles that has been using the road that has been recorded is also dropped 40%.
Okay, interesting.
What a coincidence that it could translate that if you reduce the number of cars on the street, you can also reduce the death rate. So that's become the policies of the new governor that has been elected last year. So his policies is to reduce the personal automobiles and encourage people to use public transport more. We also play the important role by encouraging and promoting people to use walking and cycling to connect to the public transport.
Jesus, in Guadalajara, Domingo Recreativa has become a citywide ritual and something very popular. Maybe you could tell our listeners a bit more about it.
I think the Via Recreativa is one of the biggest changes that have happened in the city that has been helping to change the car culture in Guadalajara. The Via Recreativa is a space where we suspend the use of cars in a lot of streets and avenues, main avenues in the city. So it's only on Sundays from 8 a.m. to 2 p.m. It's only for the use of pedestrians and bicycles, skates, and other kind of non-motorized vehicles, and dogs, of course. So the people can go there and do many activities. In this year, La Via Recreativa celebrated its 19th anniversary and has become one of the favorite spots to visit for tourists, for example, and for the locals. We have almost 31 kilometers route in Guadalajara. So just in Guadalajara, Zapopan and Tlaquepaque, other municipalities, also have another amount of kilometers where we suspend the traffic. In 2007, the municipality of Zapopan joined the initiative of Via Recreativa, and Tlaquepaque in 2008. So we have already in Guadalajara 31 kilometers and around 100,000 people going each Sunday to visit La Via Recreativa. In September 2022, La Via Recreativa obtained the international recognition from the Cycle Path Network of the Americas. So it's recognized internationally as an example program model. So we have 5,500,000 people each year going to La Via Recreativa, around 100,000 people each Sunday. And there happens around 35 permanent activities around the Via Recreativa, yoga classes, salsa, different kinds of dancing, martial arts, etc. And we have around 700 social servers each Sunday helping the people to orientate in the Via Recreativa, and around an operational staff of 100 people from the municipality, and 25 municipal agencies participating in the operation of Via Recreativa. Around 50 educational institutions also participate in the assignment of the social service providers. And we install around 800 safety signals each day that we have to implement the Via Recreativa. And to give some more numbers, 53% of the users of Via Recreativa go in a bicycle. The other 40%, it's walking or running or jogging, etc. And 7% use other kind of non-motorized vehicles like skateboarding, rollerblading, etc. And it's a perfect example to show people how can we live in a city non-dominated by cars and motorcycles. So it helps a lot to change the mindset and the culture of the people in Guadalajara.
So, Jesus, can I ask you questions?
Sure.
If the car people, protest against these activities at the beginning of the activity, yeah.
At the beginning, of course, because it was a huge change for the common operations of traffic in the city, even in Sundays.
Right.
That's the reason why we do it in Sundays and in holidays. It also happens, for example, Mondays after a holiday day. For example, this weekend we have on Sunday the Via, and also in the Monday because we have a revolution anniversary happening.
Yeah.
So
how do you deal with it?
We had many protests, dialogue with every program we do. It involved a lot of tables to talk with the leaders of the neighbors, to give them information and understanding of the positive benefits of La Via Recreativa. As authorities, we have to take the decision to do it anyway,
right,
and implement the Via Recreativa. There were still protests and etc. But in the time, we have almost none because the benefits are very clear and the people is using La Via. So a very clear aspect is the commercial one. So the locals, the commercials have registered an increase in their incomes very significant. So they are the first ones that are asking to make more kilometers of Via Recreativa. We are now connecting more municipalities in different streets with commercial use. So that's a big ally in the promotion of Via Recreativa.
Wow, great. Thank you.
I can see Silpa is taking notes.
Exactly,
Jesus, so
yes.
I'm sure he's going to put this into use very soon. Silpa, tell me more about the Old Town Bangkok initiative you had. How was that?
This area, the Old Town of Bangkok, is like a tourist destination, and the planning of the city is quite very beautiful. It's meaning like it's a block-like. The area is quite compact, and it has everything in the radius of 2 kilometers, which is the radius that people could walk from here and there easily. But the residentials themselves don't walk anymore. It's because the small street in the old town of the cities has been replaced by traffic lanes. If you have been there, you could see that there was no sidewalk at all on any street in the old town of Bangkok, which is very sad, because people has to walk. Some people who still walk need to walk among the cars, among the traffic, and but most of people has been moved out of these areas, and there are only like elderly people who still live there, who has owned the house there. And since we promoting this walking and cycling in the area, we could see like new shops has been opened up quite a lot, and people start coming back to this area. And not only we change the environment of the street, of the whole area itself, we also doing like a tourist place. And because if you are foreigners and come to Thailand, and this is like a destinations that you need to go there to see like a old town. And we also gonna have activities instead of a bus ride tour. We're gonna have like a walking tour instead that show people around historical place, a lot of historical place in that area.
And did you encounter any challenges in terms of changing kind of mindsets about it?
Of course.
What was...
Yes.
And what was it?
It's a habit of people. Some of the people don't really understand the benefit of having a lot of people walking in their areas, because there are also concerns about, only parking, only accessibility of the cars. They always see the cars as their customers. So I actually had to go there and count the number of the customer who get into their shops, and how many customers come by cars, and how many customers come by foot, by walking there. And it turned out like almost 80% of their customer has come by foot.
Of course. Of course, public transport also. So.
Right, yeah. So that's one of the challenges that we need to do. More of the work to show the numbers to those who protest. Until they realize that, okay, so this is benefit to them. Then okay, go ahead and continue your projects. We don't really support, but we don't argue and we don't complain. Something like that.
It's the classic no parking, no business.
Right.
Happens the same here.
So Jesus, Silpa mentioned some of the research they're doing to use it in designing some of these initiatives. Did you use any research, public health research, or any other evidence in designing your initiatives?
First, we try to always have public data before implementing any intervention of infrastructure in the streets. So we start from the knowledge that road traffic crashes annually claim around 1 million lives and cause around 50 million very serious injuries in the world. And that's not different in our city. So we started to analyze how many people die or had injuries resulting from road traffic crashes as a public health problem. So each intervention we do now measure this kind of public health problem before and after the implementation of our projects to see if we have a reduction in these road traffic crashes. We are part of the Bloomberg Philanthropies Global Road Safety Initiative. So we have received important support to evaluate road safety in our city year after year and refine information and, above all, evidence-based decision-making, scientific, for example, to decide where to invest public resources to modify the infrastructure and reduce the risks. Currently, we already have many interventions on roads that have shown over time, because you need like at least 2 or 3 years to measure the interventions, that they have worked in terms of reducing accidents with deaths or injuries.
So you have that data already?
Yeah, we have already the data to confirm that happens. Now we are working with the Johns Hopkins University through the initiative to update the economic costs generated by road accidents in our city. We want to measure how much is the cost of each road accident in the state and in the city in terms of public health attendance of these road traffic accidents. All the efforts we are doing now are based on decision making on data and evidence. It's a huge challenge because the quality of the data is still a little bad. It's not the best one. So we are making the steps in Guadalajara to achieve that, so we can know in each moment what is happening in our city. That's the ideal. Where are the road accidents happening in each hour, each day, in which location, what modes were involved in these accidents. So we have a lot of this information, but not in real time. And we still need to improve more technology and to improve our data collection methods, so we can have more accuracy to define the causes of the road accidents in the city. But I can say we have enough information to decide where we have to make a modification in the infrastructure to provide a better quality and safe road in our street. And we are measuring that, and we are showing the good results of doing this investment, these public investments, in terms of saving lives each year. So that's something very clear in our public politics, and it's improving each year.
What about public health data, Jesus, like in terms of non-communicable disease reduction or prevention of some of the health issues? Is there any attempt to look at that or look into the future? What kind of changes have happened in terms of exercise, or how about that?
There is still much to be measured in our city in that term, to be able to demonstrate with evidence that these benefits are being generated. What we do know is that the bicycle trips and pedestrian trips are increasing considerably after the construction of almost 134 kilometers of bike lanes in our city. And we know that every kilometer that is pedaled avoid emissions that affect health and generate a cardiovascular improvement for the people that is using the bicycle. But we don't have actual studies that give us like a more scientific approach of this direct impact in the people of Guadalajara, because we have to cross, of course, the quality of the air, the kind of pollution we have here, and what is actually happening with the people that is walking and bicycling in the city.
Silpa, what about Bangkok? Any way to measure changes, especially on the health or health effects of the changes? Any attempts there?
So it is very hard to research for direct correlations between active mobility and health data. There are so many effects on health rather than just, only the active mobilities. But what Jesus says about the pollution, that's very interesting things is because we haven't integrated that kind of dimensions into our research yet. But maybe if next projects that we're gonna be doing in Bangkok, we probably gonna using that sensors, measuring air qualities inside the area that we promoted and to see if the air quality is better or not. To answer you, Gary, to find the direct correlations by promoting active mobility is still hard to do. I still don't see how could we be doing it in this term of the length of the projects, because it probably needs like 5 more years just to see the cost effects of promoting active mobility, for people to improve their health.
I understand. I'd like to end by asking each of you to give 2 or 3 lessons that you'd like to share with other cities. We have listeners from all over the world, how we can look into inspiring them to replicate some of what you do. I already saw Silpa was taking a lot of notes, Jesus, from some of the things that you were saying. So what advice would you have for our listeners who are in cities working on similar issues? Maybe we can start with Silpa and then Jesus.
The most important thing is scientific evidence, just like Jesus says about that. So we need to collect data, and every argument that has been raised in doing these projects, we've been showing them the data. We need to talk about numbers. Otherwise, by showing their emotions, effect of changing the street, changing the environment of the city is not enough. It doesn't convince people to follow along with the treatment that we implement into the city. So I recommend doing a lot of gathering data, public data, and then doing research to show them, and especially before and after comparisons, after the treatment that you have been implemented into your cities, and using that result to show them, why don't we do more like this in other places too, something like that.
Thank you. Jesus, what about you?
In my experience here in Guadalajara, I can say that the involvement of civil society is essential to make changes in the politics. We have a very active and organized civil society promoting mobility as a human right here in Guadalajara and in Mexico, in the whole country. And this involvement want to make the rights of cyclists and pedestrians visible. The right to the city, the defense of the environment, have provoked that in Mexico and Guadalajara, we have taken important steps in this regard. So now we have laws and regulations that allow us to act as authorities. So the first lesson is to get this civil society involvement and provoke changes in the regulations and laws that can support then the legal investments and transformations of the infrastructure. Second, it's very important to understand that all the road traffic fatalities can be prevented. Reaching the goals of 0 deaths and 0 serious injuries is possible. A fundamental first step in this direction is to know and understand the causes of these road traffic fatalities, as well to have precise data, as Silpa said, and that allow us to solve the problem in depth. We need a scientific evidence in this term to make correct decisions. And maybe the last one, there will always be political costs of doing the right thing. We have to dare to do it. And of course, it's preferable to do it with enough time to demonstrate that the projects work. So you can implement and then measure and demonstrate the benefits of doing it. In that sense, the political cost is lower, or there can be none, as has happened in Guadalajara. But we also have to know that we don't always have time. The climate crisis is here and it's happening, and we have to act now. And the deaths and injuries are happening each day. So we have to act now. So I can say, do not be afraid of the political costs if you do the things correctly, very well planned, with scientific evidence-based decisions, and with the support of civil society organizations.
I think it's an excellent, your last point, that there will always be political cost is a very good message to remember for all of us. Thank you for joining me today, Jesus, and thank you, Silpa. Good luck with all of your initiatives and stay on your targets.
Thank you, Garry. Thank you, Jesús.
Thank you, Garry. Thank you, Silpa, for sharing.
The thoughtful planning and creation of inclusive urban spaces can have a significant impact on reducing the number of deaths attributed to poor air quality, road traffic accidents, and of course, chronic diseases. It also has the added benefit of enhancing social connection in city environments that can often feel isolating and lonely. I think Jesus and Silpa are excellent examples demonstrating the importance of government champions and civil society leaders in public health. As they both mentioned, often the biggest obstacle to achieve healthy cities and healthy populations is changing mindsets. Jesus gives encouraging message to all of us. May we never shy away from doing the right thing, even if it comes with a cost. Let's hear from Sally Chu from Vital Strategies. Vital Strategies and World Health Organization and Bloomberg Philanthropies support the Partnership for Healthy Cities, of which both Guadalajara and Bangkok are active members.
What a great discussion. These two busy, car-choked cities face so many of the same challenges. We've seen that it's just not easy getting decision makers in cities like these to completely reimagine transportation, to go from a car-centric model to one that's people-focused instead. But the evidence shows it's really the only way forward. The health and safety benefits are so dramatic in lives saved on the road, cleaner air, and increased physical activity. The work Jesus and Silpa outlined is being conducted through their city's participation in a global network. The 73 cities in the partnership have committed to reducing noncommunicable diseases and injuries through specific evidence-based interventions. City-to-city conversations like the one on today's podcast are a huge part of the partnership. So I just wanted to close by saying thank you to Garry, Silpa, and Jesus, and that I think a lot of listeners will be fascinated to find out what these two cities are up to.
Thank you, Sally, for your message and for supporting us with this episode. I'd like to also take this opportunity to make our listeners aware of the podcast called Vital Talks from Vital Strategies. Vital Talks engages with innovative leaders to examine health equity and collaborative approaches to improving health. Their new season will be launching soon. To learn more about the topic discussed in this episode and how to find the links to Vital Talks podcast, visit our episode webpage. There you will also find additional readings, show notes, and translations. And of course, don't forget to get in touch with us via social media, email, or by sharing a voice message with your reflections on this episode.
Global Health Matters is produced by TDR, a research program based at the World Health Organization. Garry Aslanyan is the host and the executive producer. Lindy Van Nicker, Maki Kitamura, and Obadiah George are content and technical producers. The podcast editing, dissemination, web, and social media designs are made possible through the work of Chris Coase, Elisabetta Dessy, Isabella Suder-Dayao, and Chembe Collaborative. The goal of Global Health Matters is to produce a forum for sharing perspectives on key issues affecting global health. Send us your comments and suggestions by email or voice message to tdrpod@who.int, and be sure to download and subscribe wherever you get your podcasts. Thank you for listening.